Hi, my name's Brian Vaughan. I'm a dentist with a special interest in endodontics, and I take referrals for endodontic treatment. I think the main thing is that, like the CT scanner. It's a great toy to have and a great tool. Really, it's just going to be fantastic. That's it. So because it's new, it's got the best software, so you can see things better. For me, I'm able to look at a tooth and see exactly how many canals, be able to see complications before we've even touched the tooth, to know what we can expect whenever we are actually working. I think it's certainly very contemporary premises that we're now in the new building, which is beautiful. I think it is at a very high level of service that we can offer. The recent addition of the CT scanner is fantastic and will be of great use. Personally, I use a microscope when I'm treating, which allows me, again, to deliver the highest level of service possible. A high level of magnification. It has an LED light source which illuminates the area we're working, so it just allows me to see everything that I need to see. So I'm able to treat more complex teeth that have maybe had a root treatment before and the root treatment's failing. I can redo that and stop an infection, diagnosing fractures in teeth, finding missed canals, finding canals that have become sclerosed where they're not actually visible for a dentist. And again, with the aid of the microscope, we know where to look for them, first of all, and then to treat them. I've known David for a long time now, and I can say 100% that he's one of the best dentists I've ever seen, and he is my own personal dentist. I know that the team on the reception are very patient focused. They will always call my patients a day or two after treatment to see how they are, and there's a good follow-up, and there's a good personal touch as well. There's often, conversations held after treatment for a long time, asking about holidays or family, and there's a real caring aspect, I think, to the overall service.
Right.
So my name is Jennifer. I'm a receptionist at Boyne Dental. It's the 10 of us. We're a good group. We're very well knitted. We get on really well, all of us. We can joke, we can laugh, and we work well together. Dave kind of gained more trust and gave me more jobs, such as the website, Facebook, Twitter, Instagram, all those kind of things. He sent me on a course it was a course about how to understand, like, how better to use Facebook, how to understand Facebook from a business aspect, how to better run your website, how to get all the Google views that you need, and such as. But he's always encouraging, always saying, like, you need to try this, or can you do that, or let's see how you get on with this. We'll give you that task for so many weeks and see how it works. If it's not working, it's okay, we'll change it up. If it is working, great, we'll go ahead with it.
I hear it when I'm out at the weekends. You hear it from people how good the whole surgery is, because they're getting the information across the internet and they're seeing it for themselves, so they know exactly what's here. And also the facial aesthetics has started now, so it's everything is here for them. They do it all in one. Another part of this practice is that I would do the lab work here on site. There would be very few dentists that would have a lab technician on site to do night guards, whitening guards, retainers, and immediate dentures or additions to dentures. So basically, I would do a lot of that work, and that would be done within 24 hours.
So they sent me on courses to Bristol and London, and I'm going to go back to college now this year to do some more training.
We have an area where the phones are answered outside of the reception predominantly, which is great because anyone in reception, patient-wise, will get the full attention of the receptionist generally, which, number one, appears a lot better, and number two, if your full attention is on the patient, then things are going to run a lot smoother, for starters. On the phones, then, since they are taken out of the reception, appointments run much smoother. So when we have appointments booked, we get a lot of information out of that patient, and that is most of the time recorded. So before the patient ever comes near or towards myself, I will have information on that patient, which helps with my consultation. Since I've been here, there hasn't been a patient that has slipped through the net.
My name's Barry Mullen, and I am dual qualified as a dentist and a doctor. I've been to Boyne dental implant. Fantastic. You wouldn't know I had an implant. No one likes going to the dentist. But again, I had anaesthetic placed, and I suppose initially that's not the nicest thing in the world, but the experience on a whole was actually really, really good. And I think I was probably more anxious than I thought I was going to be, and I was put at ease and relatively pain-free the whole way through as well, which is great. I'm a bit unusual. I'm a dentist, and then I went back and did medicine as well. So my whole idea was for maxillofacial surgery. So the surgery is a big point with me, and that's how I knew that if I went to David that I could trust him and that he'd be one of the best. He's very committed. It's quite funny in the fact that he gets excited about his dentistry, which you don't often see people do, and he's very keen to tell you about new techniques, and I found that very, very funny actually at the start, but he gets really enthusiastic and keen about it, and he always wants to do his best. If it's not the best he can do, then that's not the way he do it. Anything, be it from materials to the whole setup of the surgery, you can tell he's a perfectionist that way. And I think the best thing is that David would always go for the best on himself, and so that's kind of the way he treats his patients.